Hello, this is Dr. White. I want to talk to you briefly about neuropathy. There are three basic types. Diabetic or pre-diabetic is probably the most common. There's chemically induced, people that have had chemo, radiation, long-term use of an antibiotic, for example, a tick bite. And there are other drugs that can cause neuropathy. But then there's idiopathic, meaning we don't know what the heck causes it. Diabetic or pre-diabetic neuropathy is the most common. The little tiny blood vessels in your feet, for example, can be so small that only one red blood cell gets through at a time. So they get clogged up very easily due to the byproducts of pre-diabetes or diabetes. So the nerves don't get oxygen. And when the nerves aren't getting oxygen, they start dying. The first part of the nerve to die, you might feel like there's a sock rolled up in the shoe, or possibly tingles, numbness, a funny feeling in your feet. As the nerve continues to degrade, it will start burning, and then eventually shooting pain as the nerve really becomes compromised. So it usually starts in the toes, the feet, maybe the fingertips, and then it will go up the leg. It'll go about halfway up the calf. When it does that, this is severe, folks. You need to do something about it. And then it can get up to the knee. It can get so bad that you can't feel the brake or gas pedal, and you start losing your balance because you don't feel the floor. So you can stop it and reverse it if you do the right treatment. Gabapentin, Neurontin, Lyrica are horrible drugs. Lyrica actually causes neuropathy. It's one of the side effects. Gabapentin, Neurontin, suppresses the entire central nervous system. It causes the synapses between your brain cells not to work right. So it's not fixing anything. It's just simply taking the edge off of the symptoms while the drug is hurting you long term. It's just, in my opinion, it's just not a good drug. So anyway, the deep tissue robotic laser that I use causes your own red blood cells to release nitric oxide, which is a vasodilator. The blood vessels open up and the nerves get oxygen so that the tissue can regenerate and heal. So it's an amazing procedure. If it's chemically induced, if you've had chemo, radiation, or something else damage the little nerves in your hands, feet, or arms, legs, the laser can cause a speeding up of the metabolic activity of the cells so that the tissue can get energized. The laser beam causes ATP, or energy, to be produced very rapidly by the mitochondria within the cell, and the cells can actually get healthier. So it can even help with that situation also. And as far as idiopathic, not knowing really what's causing it, in all three of those cases, the deep tissue robotic laser appears to oxygenate the nerves and cause tissue regeneration. So you don't have to just get worse and worse. You can do something to get better. So we're doing a no-charge first visit in my clinic. Everything I do on that initial visit will be free. It'll take about 45 minutes. I'll do a Doppler ultrasound and check the blood flow in your hands, your feet, your lower legs, depending on where you're having the symptoms, to see if it is an oxygenation issue. And then I can do 2 free laser treatments to show you what it's like. And a lot of people see a change even after the first one. So to get the free visit, call 703-730-0200. That's 703-730-0200. And just tell them you want the free first visit. So God bless you. I look forward to meeting you and helping you get better. And I'll see you soon.